in Rational Emotive Behavior Therapy from Albert Ellis Institute, New York. She is proficient in providing advanced level guidance for children, adolescents, and adults. In addition, she has received training in cognitive behavior therapy and acceptance and commitment therapy. Today's session will be chaired by Dr. Divya Prasad, ma'am. Dr. Prasad is a clinical psychologist and hails from the Black Diamond town of Dhanbad. She completed her MPhil in medical and social psychology and PhD in clinical psychology from Renpas, Ranchi. She owns and manages Divya psychological counseling and counseling clinic in Lucknow, and has actively participated in teaching and clinical work in the field of mental health. Her areas of interest include emotional problems of adolescents and young adults, self-harm behavior, borderline personality disorder, and body image issues, to name a few. She has delivered various research papers at both national and international platforms, including the prestigious Royal Australian and New Zealand Congress of Psychiatry at Hong Kong, Regional Congress World Federation of Mental Health at Singapore, SARC Kolkata, and IACAM 2019 at Chandigarh. Her paper titled Reflections on the Therapeutic Journey Uncovering the Layers was published in Applied Psychology Readings Selected Paper from Singapore Conference on Applied Psychology in 2017. Apart from her perspective on mental health issues, she also likes correlating and understanding mental health concepts through cinema, short films, and books. We welcome you, ma'am. Over to you, Divya, ma'am.
Hello, Ms. Shruti, and I'm looking forward to an insightful session on REBT. And I would request the speaker to start the session towards more grounds for learning for all of us.
Thank you so much, Divya ma'am. It's been a pleasure to be on this platform and to share some of my learnings and to learn from you guys as well. So I'll share my screen. Is it visible?
Yes, ma'am, it is.
Okay. So today we are going to discuss REBT techniques for management of anxiety. Divya, I just want to know, how are we communicating with the other participants? Are we through chat or what?
Yes, ma'am, through chat. I request all the participants to put their questions and queries in the chat box. We'll be taking it towards the end of the session.
Okay. I just want to know how many of all who are listening know about REBT and its structure.
The participants can put their answers in the chat box.
Yeah, anything what REBT is. Have anybody done it, seen it, or maybe read about it? I can't see the chat box.
I'll communicate to you.
Okay. Okay. I just want to understand how many of them know, so that should I quickly jump to it, or should I go slowly and go with the flow of REBT? What is REBT?
Yes, ma'am. We are getting some answers. We learned in our coursework, learned during our academic course.
Okay.
So we are getting answers.
Okay. So REBT is Rational Emotive Behavior Therapy. It's a form of cognitive behavior therapy, and it was introduced by Albert Ellis. And I was fortunate to learn from same Albert Ellis Institute, New York. So today I just want to, Divya ma'am ne bataya, like, who am I? So I'll quickly jump to another slide. I am registered, and this is my venture, Mastishk, and I deal closely with adolescents, children, and adults. So what are the themes of anxiety? Um, would anybody would like to share what is anxiety according to them? Just like, have anybody else felt anxiety sometime near the exam, or maybe giving a PPT like today? Okay, while we are getting the answers, I'll tell what I think what anxiety is.
Yes, ma'am.
The
We have
fear
an
of,
answer.
yeah,
Have an
I
answer in the chat box.
fear of
Fear
known or
of
stimuli. Yeah,
known or unknown.
yeah.
Persistent, persistent
Well,
worry.
persistent worry, yes. So the themes, what we call in REBT, is the theme of anxiety is relying on gut and feeling without evidence. So a good example would be, I have a feeling that my spouse is going to face a big problem at work. I don't have any evidence of that, but I have a feeling that it will come true. And that kind of thoughts can be a triggering thoughts in case of anxiety. Another theme of anxiety can be overestimation of the prospective problem. So, overestimation is when the problem is not so big, maybe it is big, but we see it as a big dinosaur approaching us, like on the picture. So, that could be an example like the upcoming exam is going to be so tough that I won't pass or I'll definitely fail. The next theme of anxiety is the underestimation of our own problem solving capacity. So when we are feeling anxious, we do underestimate our problem solving capacity, that I don't have the skill, or maybe I am unable to, my brain is feeling foggy and I can't think properly. And generally the theme is that you feel small in front of the prospective problem. A good example can be, I don't think I can tolerate being in a crowded place, in case of claustrophobia and cases like that. The fourth theme of anxiety is a behavioral theme, that is avoidance of the problem or the avoidance of the trigger. So it becomes a coping strategy, generally, the patient who is feeling anxious. So they generally think that, let me avoid the situation where people might judge me, for example, in case of social anxiety. So all of us, I think, do feel anxiety at one point or the other. I know I do. So can anybody tell me that, have they ever felt anxious ever in their life, and which of these themes they've felt ever? It could be overestimation of the prospective problem or underestimation of the problem solving skill. So before this PPT showing and this webinar, I was feeling little butterflies in my stomach. It could be a sign of a little bit of anxiety, I would say. I'll jump to the next slide while we get the answers. So I think I got the answer. Second one, okay. There is a example. I'm a 25-year-old boy in love with a 30-year-old woman. She told me that she is going on a vacation with her friends. Now I'm thinking, can someone put them on mute, please?
We request the participants to please put their mics on mute.
Now I'm thinking, what if something bad happens to her there that will be unbearable for me to take, and I will be devastated. So reality is that इसमें हम जो what we can prove is that the person is in love with a 30-year-old woman and she is going on a vacation with her friends, which is a fact. But then thinking process or the jumping to conclusion could be that I am thinking, what if something bad happens to her? That is an inference. And then the belief that changes, the entire process of thinking and worrying is that it will be unbearable for me to take or, accept if something bad happens to her, and it will be devastating for me. So the critical A, that is, the triggering point is something bad might happen to her. The irrational belief, as it said, that if that comes true, I won't be able to bear it and it will be the end of the world for me. The emotional consequence related to anxiety or worry in this scenario is anxiety, and then behavioral consequence could be rumination, like thinking about the problem again and again, or making more scenarios to continue the upsetness. So when we say upsetness, how we continue to remain upset even after the trigger is gone. Can anybody tell me how we continue to stay upset? How do we remain upset about a given situation even after the situation is gone? We've passed that situation. Overthinking, okay. Yeah, we keep on ruminating about it. We keep on thinking that that is true due to overthinking or vicious cycle, yes. And behavioral consequence also depicts like try to control the situation. So in this scenario, the person might say, oh, don't go on a vacation, I think something might be bad happening to you. So we try to control the situation rather than understanding the logical side of the situation. Social withdrawal can be another behavioral consequence that comes with worry. Low self-esteem, that something is definitely wrong with me, that's why I am thinking like that. And difficulty managing relationships. These are all behavioral consequences in terms of anxiety. So REBT says that there is unhealthy and healthy anxiety. When we say there is an unhealthy anxiety, it means the emotional response to perceived danger is fear and anxious, feeling anxious, and perceived danger seems to be real without any particular reason. The probability of danger coming true is generally low. Severe anxiety leads to freezing and no problem solving. So severe anxiety means if we see maybe a rope and then we perceive it like, oh my God, if it's a snake, and then we freeze. And maybe in terms of phobia, we do sense that there is a freezing and no problem solving. And there's a lot of avoidance associated with phobias. Healthy anxiety is based on realistic fears, like being in a car accident is a realistic fear, right? So the emotional response to perceived danger is a concern rather than anxious, that I'm concerned I should not end up in a car accident, but then I do not feel anxious. So the problem solving strategy would be, in that case, is wearing a seat belt, or maybe not running on a very high speed and not jumping on traffic lights. There's the problem solving strategies. In case of driving, a lot of people do overestimate the danger involved while driving. So they might say, I might end up in an accident. I have a lot of relationships or relatives or friends who have met an accident, so I don't want to end up there. So they go on avoidance behavior towards the trigger. The basic premise of REBT is ABCDE model. Are you all aware of that? Should I touch upon that or not? Please tell me, so that things will be easy for everybody. Quickly, everybody, if they know what is ABCDE model of REBT, or should I tell about it?
Ma'am, a quick summary if possible, because I'm
Okay.
read REBT.
Okay. So REBT runs on ABCDE premise, where A is the activating event, trigger, B is the irrational belief, and C is the consequence, as we all can read. D is the disputation of IB. IB is irrational belief, and E is the effective new belief. So first of all, when the client comes to you, we ask them that what problem are they facing in their daily life. That is the C, finding out the C, the consequence. They might say that, okay, in case of anxiety, I'm feeling anxious, I'm feeling jittery, I feel sweaty hands, I feel loss of concentration, etc. So we get to know that they might be feeling anxious, but then you can always recheck that, is it about extreme worry about something that might can happen on future? And they would say, yeah, maybe, you know, there is a fear of upcoming interview that they want to give, but then they are extremely worried, what if they get rejected? So when the statements generally starts with what if, that means they are definitely worrying about the future, and it is leading to anxiety. So when they say what if, and you know, scenarios that they're building up in their head, that is all activating event or the triggers. A client can give several triggers in a session, so you have to ask about the most pressing trigger for them. That is why we call them activating event. So what activated the therapy? When we say trigger, the trigger is the contributing factor of the consequence, but not the entire cause of the consequence. That is why there is a belief, that is irrational belief, that is attached to it. In REBT, unlike CBT, we work on irrational beliefs very, very closely. There are 4 major irrational beliefs, which I can touch in the next slide. In the proper REBT session, maybe in the first session, we would like to know about the C and the A, and through inference chaining, we can get to the B. Inference chaining is what if your activating triggers is true, then what? Then what? So this is how inference chaining happens, and then we derive the irrational belief. Once we get the irrational belief, we generally ask the client that, is it true? If you feel like that, do you also think that it will be intolerable or it will be awful if that comes true? And it's good to always validate your hypothesis about the belief, because it will save you a lot of time for disputation, because once they agree that yes, it is cause of my consequence, it will make things easier for you as a therapist. After we get to know about the ABC, we do the B and C connection. It is very important in REBT. I would say finding the activating event and B and C connection is the most important part of REBT. When we say B and C connection, it means we create the connection with the client that irrational beliefs are the cause of the consequence rather than the activating event. So people who have read about REBT can tell me, do they know about the B and C connection, how it is made? How do we tell the client? How do we give the insight about the B and C connection? Anybody? How do we do that?
Ma'am, it's a general guess that maybe we bring that into insight related to their behavior. Is this that they are thinking? Because in their statements only they might see, say their irrational belief, like, I also feel that I'm useless. So we can counter ask them that, is it this that sometimes you do believe this, that you are useless? And then when they say yes, then we can establish the relationship.
Okay. Yeah, that's a good point, to have an inference about that. Whatever they are thinking, is it true? And they might say, yes, it is true. But then finding the irrational belief and the connection between the consequence is this, like, for example, a person is saying that I'm going to fail in the test that is coming up, and that will be awful. So the irrational belief is the awfulization part of the failure attached to the test. So when we say that, if you fail, will it be awful? And then the client may say, yes, it will be awful. Don't you think it is awful if we fail? So we get one irrational belief, awfulization of failure. And if we ask the client, 100 people, example, like say 100 people are giving the test, and the 100 of them think that if we fail, do they all, will feel anxious that it will be awful? He might say, generally clients do not say, no, it's not essential. Some might be feeling depressed, some might be feeling, shame, some might be feeling guilty. Then you ask that, why is it then, if the trigger or the is same, that you might fail in the test, they are feeling differently? Then they would say it is because of the thinking. And not just thinking, it is about believing that if you fail, it will be awful. Not all people think that if we fail, it will be awful. Some people who are logical, they might think that, okay, I fail in a test, I might fail in a test, but it is not sure, first of all. And if I fail, then I'll have some learning about my preparation, and I might prepare better next time. So you know how our beliefs are connected with the consequence. This is how we create the BC connection. After we create the BC connection, the client understands that the upsetness is coming from the beliefs rather than the inferences they are, deriving. So they also get to know that inferences are generally changeable. So for example, in one trigger, maybe an accident happening, they might think it is awful if this happens, and the other time they might they might think that it's part of life, sometime happens, ye ho gaya hoga, ya fir they might be running on a high speed, they might be not watching the traffic lights. So because our inferences are different, then beliefs are also different. So they have the proof that inferences is not equal to consequence. There's a connection between B and C more than A and C. While we say that, we do not completely reject the premise of A. Because if A did not happen, then C would not come. That is true. But it is still a trigger. It is not the cause. What REBT says. Okay. After the BC connection, we jump to disputation of IB. That means we ask the validation of irrational belief, how valid it is. So we ask different questions about irrational beliefs. And once they understand that the beliefs that they're holding on to are not helpful, are not logical, they tend to understand the irrationality part of the belief. And then they are able to derive an effective new rational belief, which is congruent to their goals. Am I clear? That was clear enough, or should I explain more? Anybody?
Clear now, but just one question, that the effective new beliefs are
Yeah.
something which will develop by their own behavior. It will not instill directly.
Effective new belief will come once they get to know that the belief that they are holding on to is not helping them. So the effective new belief will come right in the session only. This belief will be helpful to me. This belief is going to is a more logical belief. So for example, if the person is saying that if I fail, it will be awful, and that awfulness part is creating that anxiety. The effective new belief that the person after disputation might derive is it will be unpleasant or uncomfortable if I fail, but it is not the end of the world. It is not like on a catastrophe scale. It is not on like it is gonna end the happiness in my life.
Okay.
Yeah. Okay, so these are the beliefs that generally people hold while they are anxious, the predominant beliefs in anxiety in relation to demandingness, low frustration tolerance, catastrophizing. There's one more belief, self-downing, which is generally a belief associated with depression and loneliness. So a person who is feeling anxious, they might holding onto this belief that I must know what is in the future for me. So the demand of certainty. I must be loved and approved at all times. I must be successful at all times, a demand of certainty. Then there is musts or shoulds from others as well that might be associated with anxiety. That could be other people must always validate me as a good person. So we generally seek social validation or validation from our parents sometimes. Another belief which people generally hold is life must be fair to me. So demand of fairness. Life should be comfortable for me. This is a very predominant belief in case of procrastination behavior. So people generally who procrastinate, hold on to this belief that whatever task I need to do is very uncomfortable for me. It is too much to handle. So let me just fiddle with my mobile or maybe go through the reels on Instagram because they are comfortable for me, and they generally procrastinate the important work that is in hand. The other belief is awfulization, which I said OMG. It is awful if people do not like me. So if they get to know somehow that people do not like them, or they have this thought that, okay, people don't like me, they also awfulize that. So belief associated with it is awfulization. They might also think it is the end of the world if people in my house does not approve of me in case of validation, like seeking validation. So they are awfulizing the non-validation part of the scenario. Low frustration tolerance means that I can't take it. It is very difficult for me to accept. It is difficult for me to tolerate the triggering part of the situation. So that means if others do not like me, I am nothing. It is a very, very self-depreciating thought. If I failed in a task, that means I'm a failure. So it is also a very self-depreciating thought. LFT, low frustration tolerance, looks like I cannot tolerate embarrassment or humiliation. And it is very closely related with anxiety as well as shame. I cannot tolerate embarrassment or humiliation. I cannot take failure in any task. So there is a demand of certainty as well as demand of perfection from oneself when people think like that. Okay, now we are here and talking about intervention for anxiety. After we do A, B, C, D, E of the theoretical part, we come to the homework which we assign to our clients. So I think a lot of times I end up giving this worry jar homework. The worry jar techniques involves writing down the worry into a piece of paper. By doing so, it helps us identify and name the anxiety. Worry jars come from journaling therapy techniques, but as an easier strategy. For some people, they do not know what are they feeling. They say, "मुझे अच्छा नहीं लग रहा. I am just feeling weird." Some people say, "I'm just feeling upset about it." So generally, worry jar really helps them because then they can pinpoint that what is the like associated trigger and what were they feeling that time. It is very helpful for the people to know what is going on in their head. So identification of any emotion is very helpful in a worry jar technique. Another very helpful and very it shows a really good success rate. This intervention is REI, rational emotive imagery. People with anxiety generally have behavioral consequence, as we know, is avoidance. So REI tells us that we visualize something negative that might happen. So then we imagine yourself at a very specific activity that we would like to successfully do. For example, allow yourself to feel anxious as you either imagine yourself facing possible failure, in the future. While keeping the future failure in mind or the experience of failure that has occurred in mind, change your unhealthy anxiety into healthy feelings of concern or disappointment. It is important not to do this by imagining a successful outcome. So what we do in REI is we do not change the A, the trigger. The trigger is what if I fail, right? So we do not change the A. We ask ourselves by imagining a scenario that we have failed. And the belief that we're holding on to is that it will be intolerable or it will be awful. And while we do REI, we first of all upset ourselves by thinking that, okay, it will be awful. And then we challenge those beliefs while we are doing REI. So we keep on challenging our beliefs till a rational belief comes, and then we maintain in our imagination the future possible solutions that we can give ourselves. Maybe time management could be a good problem solving strategy, or maybe low procrastination, or maybe giving yourself the more time to learn, and enhancing the skills which might help in future endeavors so that we do not fail. So keep trying to experience these healthy feelings of concern, sadness, or disappointment. So REBT says that concern, sadness, and disappointment are still healthy. But they're still negative emotions. Healthy negative emotion means that they are healthy because they are manageable, but they're still negative, because if we fail, we cannot be we cannot be non-upset about it. We would be upset, right? But the level of upsetness is dependent on our beliefs rather than the failure part of the situation. Do this every day for 3 to 4 times. By doing this for approximately a month, you will see that you free yourself of your fear of failure for the specific activity that you visualized. So this was a case of, anxiety about failure. REI is a very good technique for people having phobias, or maybe social anxiety, where people are not willing to go in a social situation, or maybe they have very less communication skills. So REI is a very good technique in case you want to work with the clients who have social anxiety. Worry time. It is a very beautiful activity where we give the client a worry time. A worry time is generally an allotted time during the day in which we say to the client that this is the time that you're allowed to worry. So whenever you get a worrying thought, you think that, okay, this is not my worry time. I'll postpone the worries at all time other than the worry time. So worry time is generally a very effective therapy technique when people worry too much, or they ruminate too much. So whenever the worry time actually comes, they do not worry that much as compared to the whole day. So it is a very effective technique in intervention. Bibliotherapy is very, very, very important, and psychoeducation also works wonderful in REBT as well as CBT. So bibliotherapy is a form of creative arts therapy that uses literature to help you improve your life by providing information, support, and guidance through reading books and stories. You can even share articles to your clients. You can even share any videos to the clients which are very effective for their coping mechanism, so that they understand the therapeutic part as well as the practical aspect of anxiety, and how to manage them, so that they are not dependent on the a psychotherapist. They end up empower themselves. I would like to just end this session with, say, just because you think something doesn't necessarily means it's true. So we should keep on checking our thoughts, often, and keep on asking ourselves the rational questions. Whatever I'm thinking, is it a fact, or is it my imagination, or is it logical for me to think, or is it helpful for me to think like that? So we should not completely trust our thinking only. Thank you. This is my email, and this is my phone number. In case you want to connect with me, you can connect with me via email or my phone or my WhatsApp. I give therapy online as well as offline. Thank you so much for your time and listening to me.
Thank you so much, Shruti ma'am. Now over to Divya ma'am.
Thank you, Shruti. It was wonderful. To summarize your presentation, you mentioned about anxiety, and then the entire paradigm of REBT, which includes the ABCDE way of, uncovering the irrational beliefs, as well as relating with the A and the C, and ultimately challenging the B part. I would like to add 2 things. When I was, reading about REBT, and when I try to practice it with my clients, REBT is based on the philosophical approach that people don't get disturbed by things, but they get disturbed by the view about things.
Yes,
So that is one, one foundation stone of REBT. And secondly, somebody in the audience has asked that effective new belief. So the effective new belief emerges out of challenging the irrational belief.
yes,
And
ma'am.
this effective new belief, in turn, increases our frustration tolerance. To
Yep.
put that, the girl who had, asked you,
Yeah.
in a simpler term, that when you develop an effective new belief, you tend to lower down your increase your frustration tolerance
Yeah.
to cope up with the stress and anxiety.
Yeah.
And at the same time, you are lowering down your belief of awfulizing yourself. Am I correct?
Yes, ma'am.
Yeah. And effective new belief makes your life more simpler because it tends to change the way you are interpreting the thing. Henna? So, for example, the first example that you gave of the boy who was in love with a 30-year-old female, and he felt that, she is going and something may happen. So, an effective new belief that, okay, this is not the first time that she is going on a trip. She has gone several times and nothing had happened.
Yeah.
Is lesser anxiety producing new belief.
Yeah.
And that
So
would
maybe,
yeah.
so maybe collecting proofs from your, past that this has happened before and I did take it and it was tolerable for me. So this would be tolerable. And
Yes.
even if something bad happens to her, it won't be the end of the world because the belief was it will be awful if something bad happens to her. And generally when people holds awfulization belief, it is like, isse bura aur kuch nahi ho sakta. This is the end of the world for me. And I would say nothing is end of the world according to REBT. Like not even death of a loved one, because REBT says that okay, this would be really, 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 really unpleasant and uncomfortable, and it will be obviously, but it won't be the end of the world. When we say it is the end of the world, it means happiness is being taken out of your life, which is not true. Because a moment when somebody cracks a joke, we do end up laughing, right? So happiness is still there. It's not really the end of the world.
Yeah. So the element of humor is, introduced in REBT, which is not there in CBT. So that again differs from the Beck's CBT model, wherein Ellis's uses humor. Another thing I would like to add, and which you can, throw light upon, is the concept of ego disturbance and discomfort disturbance that we often encounter when we are practicing REBT with our clients. So whenever one is having the awfulizing belief, there is ego disturbance, and as well as, it is creating disturbance in the comfort zone of the individual.
Physical discomfort.
And again, questioning the frustration tolerance ability of us. So will you like to, elaborate it?
Definitely, ma'am. So ego disturbance is generally, for example, it would be if somebody says you're looking weird, and the ego disturbance, how dare you say that, and that the person should not be saying that, and it would be intolerable if somebody said that. That is an ego disturbance that has happened. While the physical disturbance, or what we call as the other disturbance, is this is too much for me to handle. This work is too much, and this exercise doing is too much for me. I can't go gymming. They do not take the responsibility or responsibility of the situation, that I do have a choice of going or not going to the gym, but then it is like I can't do that. This is too much. That is the physical discomfort part of it. Again, they both show that there is a low frustration tolerance about the event.
Yes. That's very nice.
Some questions here. Can you give an example how we will reach to healthy belief through REI? Okay, when we do REI, we do have an example that the upsetness is caused by us. For example, अगर मुझे गुस्सा feel करना है, I can just close my eyes and think about a scenario when somebody disrespected me, and I'll jump up to anger, right? When we dispute that, and disputation means you ask those logical questions, you ask those functionality questions about it, and then you ask about the constitution part of it, and then what would you say to your friend? These kind of logical disputation, when you do to yourself, then you arise with a new healthy belief which would say, okay, if somebody disrespected me, and if the unhealthy belief is how can they do that, they I can't accept it, we can come to a healthy belief as a yes, they can definitely do that, because they are different individuals, they can think differently, they can behave differently. Our control is not on their behavior, our control is not on their words that they choose, so they can definitely disrespect us. Their disrespecting us does not mean that we are lesser of an individuals anyway. So this is how we think healthy while we do REI, and it happens over the time. It does not happen in one go. So we keep on practicing. That is why a lot of practice is, emphasized in REBT, that you learn in therapy session and then you ask your clients to do a lot of practice while they, in between the sessions.
So maybe an example of, being extremely sensitive to critical comments by family members. So maybe, REI might help us in, learning that the critical comments shouldn't be perceived as too critical, but as a, self-growth kind of a thing. So maybe REI can help in those.
It actually really depends on what the person is believing. So a person can be believing that I can't take critical comments, or they might be thinking that, okay, I can take it, but then it means that I'm a lesser of a human being if my mother or father thinks that, I have this like a default or something. So a good strategy for any, I would say, critical comment is, first of all, removing those tags that we attach on ourselves. Like if somebody says that you've gained weight, or so generally we put a tag that okay, I'm fat, rather than we can question that, okay, if there is a skill deficit, should I address that? Or if there is not a skill deficit, then that person might be having their own opinions, which they can definitely have. So REBT emphasize a lot on unconditional self-acceptance, unconditional others acceptance, and unconditional life acceptance. That's why it is called a philosophical derived therapy. So somebody asked, Aparna asked, what if the person actually has a negative experience? How do we counter that? Example, if the person says, if I fail, people will make fun of me and nobody will talk to me. What if the individual had similar experience in the past? Where this happened? So how do we go ahead? You wrote, okay. Did you get your answer, or should I explain it again? Please explain. Okay. So the person say that if I fail, people will make fun of me. That could be true. Okay. That could be true. But, and nobody will talk to me. That is still a possibility. And it could be because of other reasons as well. That means there are inferences attached to it. What if the individual had similar experience in the past? I think in this case, you have to, through inference training, you have to ask the client, if the person says that the people will make fun of me, say, for example, if it is true, what if then? If the person or the client says that if other people will make fun of me, it will be awful, then there you go, you got your belief, and then you challenge those beliefs. So REBT says, come to the beliefs. Till the time you're not getting beliefs, keep on doing the inference chaining, keep on giving a validation to the scenarios that, okay, let's say if this happens, let's say if people will make fun of you, then what? Then what? So it also empowers the client that, okay, this might be true, but then am I awfulizing it, or am I accepting it fully or not? So it is a very good therapy, who, especially people who have a lot of insight about themselves, who take responsibility of their actions. It's a very good therapy, and it really works with people who are very consistent to work on themselves
and who have the will to change.
Yeah, definitely.
You even mentioned about healthy emotion and unhealthy emotion. That was very interesting.
Yeah.
So, yeah.
Which are the other disorders with which REBT works effectively? I think almost all of them. Like, I would not say schizophrenia, because it is a very tricky part, because there is a loss of reality in any ways. So schizophrenia के patients में, PD के cases में, OCD, anxiety disorders, depression, and I would say people who have PTSD or maybe suicidal cases, REBT has shown wonderful results, and studies have proved that. In my experience, I have worked with almost all of them, and it has shown wonderful results, keeping in mind if the patients were consistent with the therapy. Ma'am, can you please share some names of the books or resources? Yes, definitely. I'll share some of on this link, or maybe on WhatsApp, if it is okay.
Yes, ma'am. That would be great.
Okay. Anything else? Any more questions?
No, ma'am.
Okay. Thank you so much for everyone to, giving me a good ear, and they were so patient with me. Thank you, Dr. Geeta, ma'am. Thank you, Dr. Divya. It was a nice session with you, and thanks a lot. Gratitude to all of you.
Thank you so much, Shruti, ma'am, for sharing your knowledge with us. Now, I would want to invite Mr. On behalf of the team, IMHRC, I would extend my heartfelt gratitude to the speaker and our respected chairperson, ma'am, for sharing their knowledge of words of wisdom and sharing their knowledge with us. Now, I invite Mr. Sajid for vote of thanks. Over to you, Sajid.
Thank you, Divya. I hope I'm audible to all of you.
Yes, you are.
Yeah, it was indeed a very insightful session for all of us. So, to just conclude the session, it will not be less to say that the purpose of this lecture is fulfilled now, because the moment we planned of these lecture series, it was to have some meaningful discussion on the practical aspects of certain therapeutics and interventions. So this lecture is indeed one of the lectures in which we have discussed about a lot of uh, intervention techniques, and especially the practical aspects, that what we need to do in the practical scenarios. So I hope it is a very meaningful and very informative session for all the participants here. And I extend thank you to all these two speaker as well as the chairperson, ma'am, for your time. We hope to connect in near future as well for our different lecture series. Thank you very much.
Sure.
Just a notice for all the participants here that those who have registered here, and for certificate purpose, I'll be sharing a link for feedback. It is a brief feedback form which you need to fill and submit it quickly within 10 minutes so that we can process it for the certification process. Thank you. So the link will be shared in the chat section in just 1 minute.
Thank you so much, everyone. Thank you, ma'am.
Thank you, Divya.
Thank you, Divya.
Somebody asked in which WhatsApp group will the resources will be shared. I'll share it with Dr. Geeta, ma'am, and then she can share it further, right?
Yes, ma'am. The team will share it to the participants further.
Right. Okay.
So all the participants are requested to fill this feedback form, and based on that, your certificate will be shared on your registered email IDs within a week.